I went from training to doing a fellowship at MD Anderson in Texas. So that fellowship was not OB-GYN related. It was a palliative medicine fellowship. So a couple of things were that one, in Texas, the actual licensing takes about a year. So I knew that I wasn't going to be able to pick up any work really locally for a whole year. And also I knew that the fellowship that I was in was not OB-GYN based. So I didn't want to lose any clinical skill. So I kind of was like, okay, how am I going to maintain my OB-GYN skills, stay in my palliative fellowship, and then also maybe make some money? Because, as a fellow, you're still making that resident fellow salary. And again, I had 3 kids. So I was like, let's just see what this opens doors to. I knew what moonlighting was. And so I was kind of like, so like, how do you moonlight? How do you get these jobs? Like, who are you dealing with? Like, what companies are out there? That kind of thing. And I'm kind of a free spirit, so I was just Googling and was like, all right, like, let me just hit up 3 or 4 companies, see what they have to say. What does this even entail? So it was kind of just a whirlwind. I didn't have any friends that actually did it, especially in the OB-GYN world. They were like, wait, what? You're going to just go to some random town and like work? And I was like, yeah. So I got a really nice recruiter. One of my first, some of them all have different personalities. And the very first one told me about this job, and I didn't know what questions to ask. It was in Big Stone Gap, Virginia. And I was like, okay, like whatever. Like, do they have the weekends I need? Like, I wasn't really looking at the map. I wasn't having any judgy opinions or anything like that. I trained in Detroit, so I felt my skills were up to par. So I didn't think there was going to be an environment that I wouldn't be able to handle. I've lived in a lot of states. I was a Caribbean school graduate, so a lot of the times we do rotations in lots of different hospitals. So I was comfortable with going state to state. Nice. So that wasn't really a problem. So yeah, we first started in Virginia, and it was really just schedule based. Now, when I look for jobs, I have 2 main things that I look for, because I do exclusively locums. I don't do anything else besides locums. So the way I do it is I have 1 week, and then I have weekends. So the 1 week that I look for work, I look for more of like a consistent 1 week for maybe 6 months at the same hospital, a place where they would allow me to do clinic, call, surgery, so I can keep my skill up. Then my weekend jobs, it's a free-for-all. It's an opportunity to try new places and see if I like them, to maybe transition them to the 1 week gig, or if it's just a location where I have friends like Michigan or New Hampshire or Florida, I'll just take a weekend gig and try to roll it into seeing some friends. Agencies help out a lot, honestly. Okay. There has been some agencies that are better than others, and you'll learn that. A lot of the times, it doesn't take me to keep emailing them to be like, hey, where's my license? Where's this? Where's that? They're usually on it because that equates to a happy physician, happy hospital, happy contract, and everyone kind of works together. I always say, just try it. It's not a commitment. It's 1 weekend. Honestly. Just try it. You'd be so surprised. I think that because we're all very used to same hospital, same nurses, same schedule, same everything, that there's comfort in that. But I also think that there's this part to trying something new that you'd be surprised how enjoyable it is. So I always say, really just try it. And then also for moms specifically, talk to other moms. See how they cover their children, whether they have an au pair. I have friends that use au pairs, whether they have a live-in nanny, whether their partner's involved, and how you can make sure that the weight is not just falling exclusively on the partner, how you can kind of use 2 methods in one. And I would just be open with your children and explain to them what you're doing. Let them have a voice in it. Ask them how it makes them feel. And if maybe 7 days is too much, maybe you do 3. There's so many different versions to the schedule. I have friends that just do 6/24s. They spread it out because they know their babies are so little, or their significant other has a schedule that's not adjustable, that this way they can just make it make sense for their family. That's the nice part about locums, is there's nothing traditional about it. You can make it whatever you want to make it.